Hello, Global Entrepreneurship Week participants. I'm thrilled to be part of this virtual entrepreneurship conference. I'm Dr. Ryan Wakim. I'm a board certified psychiatrist here in Pittsburgh, Pennsylvania. I'm an entrepreneur myself. I've been asked to speak with you a little bit about some tips and tricks around mental health awareness and coping in the workplace. As an entrepreneur, as I mentioned myself, having started a mental health practice in 2013, which has quickly grown to over 100 employees and over 6 locations in the region, I totally understand the need for mental health awareness and the insights and tips around those, most of which we use with our own team right here in the Pittsburgh area. Right now, there's an exceptionally long wait to see mental health providers all over the country because of the pandemic. In spite of the fact we've been able to shift and do a lot of technology-based telepsych, teletherapy services, the reality is the sheer number of people who need help right now is just stressing the system that we have in place. So, unfortunately, in spite of the improved access through technology, there just tends to be longer wait times as we uh, work our way through the extremely high demand. The stigma around mental health that generally doesn't exist around more physical health related issues stems from many decades and years of not understanding mental health conditions and the causes thereof. Going back into the 1800s, 1900s, individuals, it was thought to be a character flaw when you struggled with a mental health condition. Again, because we didn't understand the brain, we didn't understand the neurotransmitter systems, we didn't understand the science behind mental health, which is very different today. We understand a lot more about the brain and how it works and how it interacts with the body and causes physical health symptoms. So the current stigma or the perception of the stigma around mental health stems from many, many decades of not understanding it. But this is a new era, and in this day and age, it's not only reasonable, it's encouraged to seek mental health care because it directly impacts your physical health care as well. As mental health awareness continues to improve over time, I think the most common myth that I'd want to dispel is that we don't understand the brain or that we don't know or have science behind the treatments we provide. There's a lot of individuals that don't seek help for mental health because it's often viewed as a character flaw or this sorcery or there's some sort of lack of scientific knowledge around what we're doing. The reality is we know more about the brain now than we ever have, and we have treatments now that are highly effective with very few side effects. And so the biggest myth I would want to dispel at this time is that we can't treat someone who has a mental health condition as well as we treat someone who has diabetes. That's just not the case. In my professional experience, the biggest roadblock individuals have in dealing with their depression and anxiety is taking the first step to reach out for help. There's a lot of people that will struggle for far too long and allow their condition to get far too poorly controlled before actually seeking help or being mandated to seek help or being encouraged by a family member to seek help. Whereas had we intervened earlier on, there's a better chance of better outcomes moving into the future. So the first step, or the most important step, in my opinion, for anyone dealing with these conditions, is to take that first step in reaching out for help. Social media is absolutely a double-edged sword. It's done a lot for our community and our profession in allowing people to have better understanding of different mental health conditions, to raise awareness and to reduce stigma. On the flip side, social media is also can feed into some of those depression and anxiety symptoms. It can lead you down, rabbit holes and paths that your mind really struggles to comprehend. So the plus or the positive of social media is the awareness piece and educating the public and providing resources that people would otherwise not have. Uh, again, balance out with the negatives being the simple fact that sometimes social media can really exacerbate someone's anxiety or lead them down paths of worsening mental health issues. As a society, in terms of trying to reduce the prevalence of substance use disorders, first and foremost goes back to what I was saying before, which is reaching out for help. People often turn to substances of abuse like alcohol, or even worse, things like heroin or cocaine, as a means to self-medicate, whether they've had a history of trauma or chaotic childhood, or whatever the case may be. Substances tend to become a maladaptive or poor coping mechanism for an underlying issue. So, getting back to what I said before, reducing the stigma and taking the first step for getting help earlier in that um, continuum will allow for improved outcomes and fewer incidences of substance use disorder of all kinds into the future. In looking at children versus adults with mental health concerns or issues, there's not one that's any harder to treat than the other. It's just understanding that they will present themselves differently. If you've listened to one of our recent podcasts, we touch on that exact point, meaning children who have depression or in bereavement or have anxiety will present themselves with very different symptoms or issues than an adult who has a little different mental or cognitive capability to either cope or to express those concerns. So treating one versus the other, I mean, there's no easy or hard. It just comes down to understanding what it looks like at different ages and then how you get the help you need at those ages. If you're someone who may struggle with a mental health condition but don't maybe have the insurance or the resources to pay for that treatment, there are specific organizations and nonprofits that can absolutely provide for some of that care. It's often referred to as a community mental health center. So if you looked up a community mental health center in your area, there's a very good chance they can provide you care either at little to no cost. Academic institutions often also have resources to provide care in spite of not having the funds or not having the insurance to bill for that care directly. So, in order to become a psychiatrist, the training includes high school degree, a college degree. From there, you go into medical school. Medical school is a 4-year program. Everyone graduates from medical school as a physician, but then you find your specialty. You're in the process of medical school. You determine which specialty you're going to go into, and then after those 4 years of postgraduate, meaning post college education as being medical school, you then have either a 3 to 8 year residency that then could follow up into additional subspecialty training, which is called a fellowship. To be a psychiatrist specifically, it's high school, 4 years of college, 4 years of medical school, and 4 years of residency. Uh, After which you can sit for your boards, and then if you pass, your test, then you become a board certified psychiatrist like myself. So it's a very common misunderstanding in today's society that psychologists and psychiatrists are one and the same. Not good, bad, or indifferent. Simply put, psychologists are PhDs in psychology. They traditionally are involved with either neuropsychiatric testing or therapy services. Whereas a psychiatrist, by definition, is someone who's gone to medical school, got in either an MD or a DO, and then went on to residency and training to become a psychiatrist. Psychiatrists in this day and age really tend towards procedural based psychiatry like TMS or ECT, or psychopharmacology, prescription based treatment. So, psychologists, PhD, therapy services, neuropsychological testing. Psychiatrists are physicians who tend to dive more into the pharmacology or drugs and or procedural. That said, psychiatrists can also perform therapy services. So different but similar through two very different paths. As I mentioned earlier, a psychiatrist is someone who's finished medical school and is, in fact, a physician. It's important to delineate the fact that there are two different credentials as being a physician. One type of medical school graduates medical doctors or MDs, but there's another type of medical school that graduates doctors of osteopathy or DOs. Traditionally speaking, DOs were more involved with holistic care, um, and algorithms thereof, whereas MDs were the more traditional physician. But in this day and age, they really are considered the same in terms of education level, clinical competency, and careers. You won't really see a difference in this day and age between the two. But in the past, someone might go the route of a DO if they were more inclined to a more holistic medicine technique. And for those who weren't more holistically inclined, they would traditionally go to more of an MD uh, medical school. In today's day and age, we'd be remiss if we didn't talk about technology as part of entrepreneurship and growth, even specifically in the mental health space. You know, nowadays we often will use telehealth, telepsychiatry to engage with patients on a regional and national basis, breaking down the barrier to care and improving healthcare outcomes. So, yes, technology can assist in many different ways. It may even be a headache for some. But again, in our field specifically, it can really help to reduce barriers and improve access to care, both locally and nationally. I hope these insights have been helpful for you and your team. If there's anything we can do to help you, please don't hesitate to find us on some of our social channels listed below or through our podcast, Mental State, wherever you get your podcasts. Don't hesitate to contact the office, whether it's for yourself or your team. And hey, maybe we can even use some telehealth to help one of you.